I'm Dr. John Storrar. I'm a Retrieval Medical Officer with the Royal Flying Doctors Southeast Section. Today we're going to be doing a tour of the retrieval aircraft that we use, which is the King Air 200, and its medical capabilities. I am not a pilot and I'm not an engineer, so we'll focus on the medical side of things today. But looking forward to giving you a walkthrough of our medical capabilities and showing you the aircraft and what we can do. So this is where we get on the aircraft. At the moment it's set up for an ambulant person to get on, but when we have a patient loaded into a stretcher, we can convert this to a wider entrance, and we've got a lift hoist that we can use to bring people in. This is the front stretcher where we'll typically manage our sicker patient. So as you can see on the stretcher, we have linen ready to go. This is our stretcher bridge, which holds all of our monitoring equipment. This is a ventilator. We use that to deliver assisted respirations. So if we have a patient who is struggling to breathe, needing respiratory assistance, or if they have a breathing tube in, we'll be using this machine. This is our monitor, which we use to monitor a patient's vital signs in flight. And if we need to deliver electricity to restart the heart, we can do that with this machine. Behind that, we have a portable suction unit, which is useful if we are needing to manage the patient's airway. And we have more monitoring equipment on the back here. On the side of the plane here, we have oxygen outlets, which we can either connect to the ventilator, or we can connect it to a normal breathing mask or nasal prong oxygen. This is another suction outlet. Back here we have power outlets that we can use to charge our monitoring equipment. And we have lighting here for if we are doing a retrieval at night and need to do some critical interventions, we can turn those on. So this is where the doctor typically sits, so we're at the head of the patient. We have headsets with microphones so that we can talk to each other in flight. And if we need to, there's a satellite phone that we can link into to call any receiving hospitals or coordination to give updates and ask for extra resources or help as needed. Because we are in a plane, it can get a bit bumpy and we have to buckle in. Definitely during takeoff and landing, and also if there's any rough weather, which means we really try to get the patient as stable as we can before we actually take off. The sicker patient will typically be here on the forward stretcher, and the flight nurse will typically be sitting here. We've got drawers here that carry a variety of medical equipment that we can reach for as we need. For example, that's our IV equipment. We've got fluids, a bag valve mask here, lots of things we can reach for in an emergency or for just patient cares in flight. These stretchers do maneuver a little bit. We can bring the patient up, sit up if they need to, bring them back down. But I have been told that they're not the most comfortable. Now, we try to get everything sorted as we can before taking off, because we try not to do any critical interventions in flight, but sometimes we do have to get up out of our seats. Now you'll notice that to do this, I have to take my comms off, so I have to let the pilot know ahead of time that they're not going to be able to talk to me. You'll also notice that this is very cramped in here. I'm not a big person, I'm 173 centimeters. There's no way that I'd ever be able to stand up in this plane. And just so you can see, I can touch both sides of the wall. Now, you can imagine with a normal sized person sitting in the nursing seat and a patient here, there's not much actual space for me to walk through and do critical interventions in flight, but we do the best we can. So behind me here is the cockpit where the pilot sits. So the pilot will sit in this seat behind me, and we usually only have the one pilot, but if there is a second pilot, they'll sit here. Now, I'll stick to my lane and talk about the medical things. I won't talk to you about the things that happen in the front here. But I will say our pilots are fantastic and get us to where we need to go safely. Thank you for joining me on this tour of the plane. I hope you found it interesting and enjoyable. We can deliver a wide variety of critical clinical interventions in this relatively small place on this plane. And for me as a doctor, it means a lot to me that we can treat and transport these critical patients, and it's all thanks to the support we get from you and our wider community. With your help, we're able to provide this level of care to patients who really need it, regardless of their geographical location or socioeconomic status, and thank you for that.